I posted it up on my Instagram, and the response I got was, wow, nobody's taking it. Yeah, nobody is taking it seriously because all we're talking about now is recovery. But in order to recover, we must first test. And that's where we're going to bring on Francis from Department of Public Health and Social Services, as Public Health is out here testing people this week. And Francis, I know there's some community outreach testing going on this morning, right, Francis? Good morning.
Hi, Francis.
Good morning, Chris. Good morning, Sabrina.
Good morning.
Good morning.
Can you just say good morning to our listeners? Because you got a good morning.
Good morning to everyone out of you listening to KUAM.
Nice. So you guys are going to Merizo today?
Oh, yes, Sabrina. We're going to Merizo to conduct the COVID-19 testing. And this testing is open to Hemlani residents. And the criteria should be is that they should have COVID-19 symptoms.
Mm-hmm.
And if they live with multi-generational families or household, like if they have their parents, godparents, great-grandparents with them, these are the criteria that they will be tested for COVID-19. And don't forget to bring your ID with you for identification.
Francis, so the criteria is you got to have COVID-19 symptoms or live in a multi-generational home. Can you kind of run down the symptoms of COVID-19 that could get you tested today in Merizo?
There's the COVID-19 symptoms, Chris, that we need to remember is that if you have cough, fever, shortness of breath, loss of smell, and loss of appetite are those symptoms that we easily remember when it comes to COVID-19 symptoms. But sometimes if you even have other, like sore throat, it's being also considered. Rest assured, we have our public health nurses who would provide the assessment if you qualify for the COVID-19 testing.
What about, I didn't hear you say loss of sense of taste. Is that one of the symptoms?
Well, yes, it should be one of the symptoms, Chris.
Okay.
That's right.
Hey, and I know it says here Hemlani Apartments, Merizo, but what if people who don't live in Hemlani Apartments who kind of want to walk up and get tested, are they going to be barred from testing, or?
Oh, no, Chris. As long as the supplies last, they will be accommodated for the testing. So, at first, we will have the Hemlani apartment residents, and then they will be accommodated as long as the supplies last.
Mm-hmm.
While supplies last. Get your test. Francis, this is the latest effort. You guys have been out doing community testing all week. Can we kind of talk about where you guys have been testing people this week?
Oh, yes. For this week, Chris. Yeah, yesterday, we're at Guma Tranquilidad, the one in Tumon.
Right.
And last Tuesday, I know it is St. Dominic's Senior Care Home.
Mm-hmm.
We have a training and testing at the same time. So this was open to all St. Dominic Senior Care patients and the sisters who are staying there or serving the St. Dominic. And there's a drive-through at the same time, which was held at Central Public Health Center at South Savannah, Barrigada Drive. So it's a drive-through testing, which happened also May 5, Tuesday.
What did you mean by...
to all home senior care home employees.
What did you mean by training? You're training nurses, or who are you training over at St. Dominic's?
Oh, what happened there, Sabrina, is that the nurses from St. Dominic's was trained to be able to do the swabbing
I see.
and how to do the testing procedure, because they'll be the one to do the testing, and so that training was for them, and so that they'll be able to perform the testing for the seniors who are in that residence.
How long are they going to have to conduct that testing after they receive the training, or has it already been conducted?
Come again, Chris? I didn't get that.
So you train them, and then they're going to test the Manumco there at St. Dominic's. Have they already been tested?
Oh, yes. First, they will be tested first, and then the testing will be done by them afterwards.
Mm-hmm. So after you guys do Merizo today, What's next? Because we really haven't heard what the plan is in terms of expanding testing.
Oh, very good question, Sabrina. As of the moment, I don't have the answer,
Okay.
but
Oh,
definitely.
good question, but no
we
answer,
want
Francis.
information.
Hey, knuckle.
Yes, we will provide you the answer as long as we have it, Chris. I
Right.
know they are currently planning on that. There is a plan.
Okay.
And when will that be and where? We will provide you the information, Chris.
That's good.
Thank you.
Francis, so I saw in your the JIC release from last night that there was testing done in a government of Guam quarantine facility. Which one was that, Francis?
Which one, Chris? I'm sorry.
In our JIC release, it says that there were people tested at a
A quarantine facility?
Oh, quarantine facility. Oh, I may not have the answer for you today, Chris. But also with that, I'll get back with you.
Right.
Do you know how many quarantine facilities are left?
Wow, Sabrina. Even with that question, Sabrina, I will.
Oh, that's
get
three
back.
strikes, Francis.
I
That is
know.
three
Oh my
strikes.
gosh.
You know, good thing this isn't baseball.
Yeah, good thing it's not, Chris. Thank you so much.
All right. Anything else you wanted to get out, Francis?
Let's talk about
yes, Sabrina.
the testing this
It
morning, Francis, for a little bit more. So, how many test kits you guys got?
Oh, with that number, Chris, I'm not so sure.
You're out of here! You're out of here! Straight!
Adequate enough for everybody who will be there in Emlanis apartment.
Good answer. Enough.
Just walk through.
I got it.
Yeah.
Okay.
Yeah.
All right. And then that's what time to what time again, Francis?
Oh, the time that we're going to have the testing at Merizo is from 9 a.m. and 12 p.m.
Right on. So you guys should already leave to get there on time. It's almost 7.
Yes, I know. And so I'll be rushing going there.
Right. And so how
Be
many?
safe, though.
Yeah,
Okay.
drive, sir. Drive
Thanks,
careful.
Sabrina.
How many people you guys gonna have down there?
How many people you said, Chris?
How many people, public health staff, are you gonna be taking down to Molesta? Are you guys taking a caravan, or how's it gonna work?
Well, for sure, I know there are some people going in a carpooling, things like that. So we'll be, as long as we'll be able to cover all the residents and like with all our testing sites, yeah, we have all our team be there to conduct the testing.
Are you guys excited to go down to Molesta? I was just there last night. Beautiful village. When's the last time you went that far down south, Francis?
Oh, it's been a long while, Chris.
Yeah.
That's why I'm so excited to see the beautiful southern side of the island of Guam.
Yeah.
Okay.
I hope you can adjust to the time difference. They're 5 years behind.
Oh, never knew that, Chris.
It's a little known fact is once you cross over the Agadumatic Mountains, it changes.
Oh my gosh.
All right.
Oh, yes. And by the way, Chris, before I forget, as we plan for the reopening, to all of our listeners out there planning for opening for their business,
Right.
please don't forget the 2 steps that CDC provided to us is cleaning and disinfecting. And for more information, visit the cdc.gov website.
What can you tell us about that, Francis? Reopening, we're talking about that. So businesses that are going to be allowed to reopen on Monday, they're going to have to disinfect and clean, and everybody has to wear masks still, right, Francis?
Oh, yes, definitely, Chris. We should still wear our mask, observe social distancing, and don't forget to wash their hands no less than 20 seconds.
Okay.
Got it. Anything else you want to add in there, Francis, about the reopening of the island? What other notes and little helpful hints do you have for the public and for businesses that could potentially reopen in some form on Monday?
Well, so far, what we need to remember is that we need to do cleaning first. We need to use soap and water to remove germs and dirt and impurities from surfaces, and then followed by disinfecting by the use of disinfectant products to kill the germs on surfaces to lower the chances of any germs present in those surfaces.
Okay. And so are we going to see, and you see videos, you go on YouTube, COVID-19 jurisdictions, they got people with the backpacks just walking around disinfecting everything. Is that what we're looking for? Is that the ideal goal, Francis? Or are we just going to ask businesses to spray things down with the Clorox water or whatever?
Well, there's a proper way of doing it, and this was provided as a guidance in the Centers for Disease Control Prevention website.
Okay, and so that's cdc.gov.
Yeah.
Okay. Okay, Francis.
Here it is. I see it. Here.
Okay, Sabrina's got it. Hold on.
Oh, I don't have my glasses. CDC guidance for cleaning, disinfecting, and preparing for reopening.
Yes.
Let's see. Public, including your workplace, home business, will require you to develop your plan, implement your plan, maintain and revise your plan, reduce.
That's why he was like, just go to the website. I ain't reading that stuff.
No. CDC has a two-step cleaning process that includes cleaning. Use soap and water to remove germs, dirt, and impurities from surfaces. It lowers the risk of spreading COVID-19 infection. Disinfect. Use disinfectant products to kill germs or surfaces. By killing germs on a surface after cleaning, it can further lower the risk of spreading infection. If disinfectants on the list are in short supply, alternative disinfectants can be used. For example, 1/3 cup of bleach added to 1 gallon of water, or 70% alcohol solutions. Is this what you just said? Did you just read that, Francis?
Yeah, no, he didn't. He didn't read it.
Oh.
What's your favorite disinfectant, Francis? What's your personal choice?
Oh, I use Clorox for my disinfectants.
Just regular Clorox and water?
Yes, Sabrina.
What's your mix there, Francis?
Come again, Chris?
What's your mix on your Clorox water?
Oh, my mix for my Clorox water is just 1/3 cup measurement of the Clorox to a gallon of water. Yeah.
So you're using 1/3. That's kind of a weak brew.
Yeah, it's my usual. There's better to have it in that measurement. It's more safer.
Right.
I'm sorry, what was the mixture? It was
1/3 of Brie, because Brie makes her own too.
Oh.
She cooks her own.
My wipes are over there.
I know.
And you're right, it is 1/3 cup of
to a gallon.
Yeah. Oh no, that's not a gallon for sure. That's,
Yeah.
Is are my wipes over there?
They finished your wipes, Brie.
Oh, okay, I'll make some more. I think it was a 1/2 cup or 1/4 of a cup or so. Or no, 2 tablespoons to a cup of water.
Right.
I think that's what it was.
Does that sound like it's regulation, Francis, or are we going to get in trouble here?
Which one, Chris?
2 tablespoons per cup of water. 2 tablespoons of Clorox per 1 cup.
For 1 cup of water. Well, that one seems to be so strong.
Oh.
Yeah.
That
Yeah,
the
2
extra
tablespoons to a cup of water.
the extra tablespoon is for good luck.
Oh.
I always do that. Just like when I make the coffee.
She's like pouring it in,
I
she's
put
like, you know what? Let's put a little more in there. Just in case there's one COVID-19 germ that just refuses to die.
Oh my
God. All right.
That's good.
Okay.
That's good, right? Yeah. You wonder why this place smells like Clorox? Well, there you go. That's why. I used to love the smell of coffee in the morning, but now I just get the smell of Clorox. Like my grandma used to say, Clorox. All right, Francis, I think we're going to get a ticket. There's just too much laughter going on here. It's supposed to be a serious radio talk show. Thank you.
All right, thanks, Francis. Drive safely down to Merizo and enjoy the ride.
And enjoy the view, okay?
Yeah.
Thanks, Sabrina.
Okay, take care.
Thanks, Chris.
Thank you, Francis.
Thank you.
Goodbye.
Okay,
Wash your hands.
Definitely, Chris.
Okay, there you go. That's our buddy Francis. Guys like Francis, you are a COVID hero, Francis. You know what I mean?
Awesome.
So chipper, so gung-ho, just smiling.
Mm-hmm.
You can just hear it. He loves his job.
Yeah. Doing
for him.
good things.
I wonder which of the COVID differential pay he's getting.